Especially if you're just starting the process of introducing your baby to food, what is it that you fear the most when giving your baby solids? Most likely it's that your baby might choke on the food or have an allergic reaction. Have you been wondering what you can do to safely introduce solids? In this video, I'm going to talk about the 5 things you can do to ensure that your baby swallows food safely and prevent episodes of choking from happening regardless of whether you're spoon feeding your baby purees or doing baby-led weaning or a combination of both. If this is our first time meeting, I'm Dr. Belousov. I equip parents with knowledge so they can care for their children with confidence. I put together this YouTube video series to show you how simple and enjoyable the process of starting solids can be for both you and your baby. Be on the lookout for more videos like this released on a weekly basis. Hit the subscribe button and ring the bell so you get notified when the newest video is released. As a pediatrician, I've been encountering more and more parents who are interested in doing the baby-led weaning approach to introducing solids. Although this approach has been around for decades, our main way of introducing solids to babies has involved the parents or caretakers spoon-feeding the baby purees. Whereas with baby-led weaning, the babies feed themselves all their foods in the form of graspable pieces or using a preloaded spoon if the food is in the consistency of a puree. Studies done by the medical community that looked at both feeding approaches have found that choking is no more likely with baby-led weaning than spoon-feeding purees. And they found that there are certain guidelines surrounding feeding the baby that parents need to follow in order to lower the risk of choking or eliminate it altogether. The following are the basic safety precautions that, if followed, will ensure that you are safely starting solids with your baby regardless of which feeding approach you're doing. First, we need to make sure that the baby is developmentally ready to start taking solids. Starting solids with a baby who is not developmentally ready for it puts them at increased risk of choking on the food and or breathing it into their airways or lungs. So what are the developmental signs that the baby is ready to safely start taking solids? The baby should be able to sit upright on his own with little to no support. The baby needs to have good head control. The baby should no longer have the tongue thrust reflex. The baby needs to show an interest in food, and the baby should be reaching for and grasping objects and bringing them to the mouth. I actually have a separate episode that goes into more detail on this. It's titled, How to Know When Your Baby is Ready to Start Eating Solid Food. It's linked up here if you would like to check it out. A lot of parents tell me that their healthcare providers recommend starting solids as early as 4 months. But keep in mind that both the American Academy of Pediatrics and the World Health Organization recommend starting solids around 6 months of age. From my experience, most babies are not showing all the developmental signs of readiness to eat till around 6 months. Some babies will need to wait even longer, especially those who are born premature. Usually they are ready around 6 months adjusted age, rather than chronological age. And if your child has other underlying developmental or medical conditions, please follow the guidance of your child's healthcare providers regarding when and how it's safe to introduce solids to your baby. Second, make sure your baby has a proper sitting position in the high chair. In order to have a safe swallow, the baby needs to be sitting upright in the high chair with feet resting on a footrest. This usually stabilizes the baby's core and facilitates a safe swallow. Your baby will also feel more comfortable sitting in the high chair when he has a stable sitting posture. Babies who have their feet dangling may end up rushing through their meals because they're uncomfortable. In addition, it's best to have a high chair that doesn't recline back. I know that with some chairs, the back is at a slight recline, and that's okay. But if you have a chair that allows you to adjust the angle, make sure the back is in the most upright position possible. When a baby is eating at a reclined angle and has the feet dangling instead of being positioned on a footrest, it increases the risk of choking. Unfortunately, most high chairs on the market either don't have a footrest or the one that comes with the chair is not adjustable. In my video titled Must-Haves When Starting Your Baby on Solids, I talk about high chairs that meet all of these criteria. That video is linked up here if you'd like to check it out. As your baby gets older and becomes more mobile, even into toddlerhood, continue to sit him in the high chair at mealtime, even if he puts up a fuss. I have seen a case where a 1-year-old child was running around while eating. He unexpectedly tripped and fell and breathed some of the food into his airways and had to be hospitalized for treatment. I don't want to see that happen to any child. From day one, let's teach the baby that eating is associated with sitting in a chair. And let's make sure that they have the proper posture of sitting upright with feet resting on a footrest. If you're finding this information helpful, hit the thumbs up button. The third precaution is that we need to minimize distractions. When a baby is sitting down for a meal, we want to be sure to minimize all distractions that will interfere with the feeding experience. Various distractions will take the baby's focus off of feeding and swallowing correctly, especially in the early days of starting solids, and this can lead to a choking episode. There shouldn't be any toys on the table, and even having a pet in the room can be very distracting to a baby. I also recommend that all electronics be turned off. No iPad, no TV, to minimize distractions. It's also preferable that you put your phone down somewhere that's away from the table. Your eyes should be on the baby during the entire meal. And as you are spoon feeding the baby or watching your baby self-feed strips of food or a puree, your focus should be on talking the baby through the process and paying attention to the cues that your baby is done with the meal. It's ideal if you can have your baby be a part of the family mealtime. Watching the rest of the family eating provides the baby with visual cues of how it should be done. Let's do our best to create a distraction-free mealtime and model healthy eating behavior for our baby right from the start. Fourth, offer food in a form and at a pace that is safe. If you're doing the approach of spoon feeding your baby purees, there is actually a right and a wrong way to do it. To spoon feed correctly, put a small amount of the puree on the spoon and slowly bring it toward your baby. And only when your baby opens the mouth, gently place the spoon on top of the tongue and hold it there until the baby closes the lips. Then slowly remove the spoon straight back out of the mouth, not at an angle. Let your baby be the one guiding the spoon feeding process. Never slide the spoon into your baby's mouth forcefully or without her realizing what's happening. This can cause the baby to have feeding aversions and the fear of the eating experience, and we don't want that. I have a separate video that goes into more detail on how to spoon feed correctly. That video will be linked up here once it's released. When doing the baby-led weaning approach, make sure the food is soft enough that it will be mashed with the tongue on the roof of the baby's mouth. The way to check for this is to squeeze the strip of food with your thumb and index finger, and if it easily mashes, then it's soft enough. A good rule to follow for the size of the strips of food is to have them about the size of an adult pinky finger, or a little thicker, and about 2 inches long. This way, the baby can grasp a portion of the food and still have some sticking out to put into the mouth. Up until the baby develops the pincer grasp, which is the ability to use the tips of the thumb and index finger to pick things up, it's safest to offer foods in strips. Most babies develop the pincer grasp around 9 months. That's when it's safest to start offering food cut up in smaller bite-sized pieces. If you give small pieces before the baby is ready, he will become very frustrated with trying to pick up the small pieces. And in the event that the baby does grab a handful of the tiny pieces and gets a bunch of them in the mouth, he has a higher risk of choking on it because at that younger age, the baby doesn't have the oral motor skills to spit out forcefully or push out with the tongue tiny pieces of food. But if you give the baby food that is cut in a strip form, then she can pull that strip out when she starts to gag and prevent herself from choking on it. Also, when the baby gets offered strips of food, he has to really concentrate to pick it up and get it to the mouth. Babies who are allowed to self-feed and are not rushed while eating tend to take smaller bites and spend more time chewing before swallowing. The philosophy behind baby-led weaning is not to do away with spoons and purees, but to have the baby be the one guiding the process and feeding herself. No one but the baby should be putting the food in her mouth, and the baby should eat at her own pace and under her own control. It's the parent's job to prepare and provide the food in a safe form, and it's up to the baby how much or how little she eats. I will have upcoming videos that go into more detail on baby-led weaning. Fifth, never leave the baby alone with food. I think this one is self-explanatory, but unfortunately, it still happens. Remember, babies are silent when they're choking, and the only way you know that it's happening is from seeing that your baby is in distress. So if your baby is out of your sight, you won't know that it's happening. In the event that you need to step out of the room for any reason during a meal, even if it's brief, for your baby's safety, remove all food from your baby's reach. You can resume the meal once you return. In upcoming videos, I will talk about how to safely prepare foods for your baby, how to respond when your baby is gagging or choking, and what to do if your baby has an allergic reaction to a food. Hit the subscribe button and ring the bell so you get notified when those videos are released. See you in the next video.